Dr. Philip Brown is the chief physician at New Hanover Regional Medical Center. He joins me now with an update on the coronavirus here in the Cape Fear. Thanks so much for talking with me.
My pleasure.
So first, we've heard this term flattening the curve. First, what does that mean, and are we showing signs of flattening the curve in the Cape Fear?
What it means is that we're reducing the rate of infection so that ultimately we don't see a huge number of people getting the COVID-19 infection at the same time. So it's more of a gradual progression that allows our health systems to keep up with the patients who are most severely ill and need help. And without a doubt, we know that we are flattening the curve at this point in time, and that's based on the behaviors that everyone has been undertaking out in the community.
So that's good news.
It really is good news, and I think it's a time to say thanks to all the citizens in the community for doing the big four things, which are, of course, 6-foot physical spacing, frequent hand washing, strict avoidance of gatherings, and now masks in public. Those four things applied consistently by a lot of people is what's enabled the curve to be flattened. And so that really is saving lives.
So a lot of people are pushing to reopen North Carolina. Is it possible to do that now?
We don't really have what we need to do that safely. The good thing is that no matter what the rules are, people can continue to act responsibly in the interest of protecting themselves and in the interest of protecting their friends, neighbors, and family. What we really need more than anything is considerably more testing and also the ability to track contacts of people who have been diagnosed with the virus. This is a key essential to be able to reopen safely.
So people are pushing for the economy to open May 1st. Is that realistic?
I think it's premature based on what we have now. And I really want to emphasize that control of COVID-19 and restarting the economy are not in opposition whatsoever. They have to be sequential to a certain extent, and we have to have certain measures in place that we know control the virus in order that we don't have false restarts, which is really considerably more dangerous from the standpoint of not only what it does to people, but also the damage to the economy.
What is the key message you want people to know right now?
The key message is that things you've been doing have been working. The big four. Continue doing that right now until we get to the place that it's safer to open based on increased testing and the ability to track contacts. Hold the line on what we've been doing. It's working, and we greatly appreciate it.
Thank you so much for talking with me.